Hi, my name is Ellen Suarez. I'm one of the credentialed district nurses for Cutler Rossi. I'm here to talk to you about diabetes and how to care for a student that has diabetes. And my references are Valley Children's Hospital, Diabetes at School. You'll see the website on some of the handouts, and then also the HANDS Diabetes in School program. So on the first page on your handout, it talks about low blood sugar. After that, it's going to go into high blood sugar. Just a quick definition, we take care of students that have both type 1 diabetes and type 2 diabetes. Type 1 diabetes is an autoimmune disease. And so it is attack of the pancreas from the body as an autoimmune response. And so the pancreas fails. It fails in its insulin production and then the action of that in the body and how it uses glucose, how the body uses glucose. Type 2 diabetes is a different mechanism, and it's usually a good working pancreas, but then you have insulin resistance. The tissue doesn't respond to the insulin, and so then the pancreas starts working harder. You can have pancreatic burnout and then insulin resistance, and those two factors lead to the glucose not getting to the muscles in the body with the insulin. So the first page is low blood sugar, so also known as hypoglycemia. This is the emergency. So this is so you have, high blood sugar, low blood sugar. This is the one that needs the immediate attention. So the page that you have has some funny little faces, and it talks about the different things that happen. So you'll notice that it gives parameters for 5-year-olds and less, and then also children that are older. So 70 is what we're usually looking at, unless we have a preschooler. So anything below 70 is an emergency, and they need to get the blood sugar higher. So you'll look at this different pictures. You have shaky, feels hungry, feels maybe starting to get a headache. So it's just like you or I, after we've gone like about 6 hours without eating, we start having some symptoms. We might be a little bit shaky. We might have a little bit of a headache. We are getting a little hangry. So these are symptoms. But for a diabetic, those can keep on going because the blood sugar can keep on going lower and lower. And so they might get some vision changes. They might feel a little bit lightheaded, like they might feel tired. They might feel anxious, and sometimes they might feel weak. So that's why it needs to be addressed as soon as possible and corrected. So we use the rule of 15s, and I will go over that when we get to the algorithm, which is a few pages back. The next page, it talks about high blood sugar. So high blood sugar also needs to be corrected, but it is not as much of an emergency as low blood sugar. So you'll see some pictures. These came from Valley Children's, very thirsty and having to use the bathroom more frequently. So the body tries to get rid of that extra sugar that's in the blood. They also might feel a little bit of blurry vision. They might feel a little sleepy, and they also might feel hungry. So you've got some of the same symptoms happening with low blood sugar and high blood sugar. So it's important to check the blood sugar, see what it is so that you know what you're dealing with. If you're a teacher or you're a coach, you're going to, and the student has a way to check their own blood sugar, you can instruct them to check it. Also, we have students that have a CGM. It's a continuous glucose monitor. So there's different companies. Dexcom is for most of our type 1s, and then the Libre is for our type 2s. With the CGM, they have a continuous, it cycles onto a cell phone. So it uses Bluetooth between the sensor and the cell phone, and then it puts it up on a website, but they can access it. It can also be shared. So that way nurses, either at the site or district nurses, can see that view of what their blood sugar is, along with their family, grandmas, grandpas, and parents. And it gives every 5-minute reading. The Libre is a little bit different. They have a sensor, and then they log on to their website, and then they hold their phone over the sensor. It reads what their blood sugar is and shows them what their level is, so that they can see that number, and then they can treat themselves accordingly. So with the high blood sugar also comes the threshold of approximately 250 to 300, depending on if they're symptomatic. Usually for students with a pump, this is an insulin pump, they will be checking their ketones. So this is our ketone strip bottle. And so this is a procedure that a nursing staff would be doing for the student. But they just test their urine, and then we go on a scale that lets us know, is it nothing to trace to small to medium. Then we have protocols according to their doctor's orders that let us know what the student needs to do, and if they're allowed to stay at school or not. Usually for medium or large, they need to go home because they need more frequent monitoring. They need to increase their fluids, and they might be taking insulin more frequently. So that's the sick day protocol, and then they will go home. We also have the high blood sugar and the low blood sugar in different format. This is through Diabetes at School. So it just lets you know, it just reiterates symptoms of high blood sugar and low blood sugar. You also have a hypoglycemia fact sheet. So the hypoglycemia fact sheet can give you reasons why their blood sugar might be low. So type 1 diabetes is very unpredictable. Their blood sugar can be fine, and then all of a sudden it can just take a dive. Hypoglycemia means that they're out of normal range. They're below normal range. So it would be 80 for a preschooler, or below 70 for kindergarten and above, kindergarten, first grade and above. So causes get too much insulin. So it's very important that the insulin be calculated correctly in accordance with their what their blood sugar is. If it's high, we give a little bit of extra insulin called a correction. And then we have to also cover their carbs according to their doctor's orders. So we might have 10 grams of carbs equals 1 unit. And it could be 15 grams of carbs equals 1 unit. It just depends on what their basal rate is and what their doctor's orders state. Also, not eating enough food. So maybe they thought they liked that hamburger, and then they got their insulin and they don't really like that hamburger. So they don't eat the whole thing, especially the bread, because that's the carb for the burger. So they need to eat something else that has approximately the same amount of carbs in order to keep their blood sugar in normal range, to match the insulin that they already got. Meals and snacks that are off schedule, increased amounts of exercise. We see that all the time. A student who gets their usual dose, then they go run the mile, they go to a jogathon, they walk to the high school for a field trip. All those activities that are extra physical exertion can drop their blood sugar really quickly. Also, being sick. If illness tends to raise the blood sugar. So they've got a cold, they're not feeling good, their blood sugar can run high. Taking certain medications also. And then signs and symptoms will depend on the student and how low the blood sugar is. So most students, once they get to be a certain age, they will be able to recognize their signs and symptoms, and they'll say, I feel like I'm low. So always pay attention to when a student who has diabetes tells you that, because they need to verify their blood sugar. It's important to always check, even if their blood sugar is in normal range. It could mean that it's coming down at a rapid rate, and they still need to monitor it closely. So it talks about treatment, taking prompt action, never allow the student to walk alone. So if you're a teacher or a coach and the student doesn't feel good and they need to be checked by the nurse, if the nurse is on campus, make sure that they don't walk alone. Send them with a buddy or call campus security. With severe hypoglycemia, they might have a seizure or become unconscious. That's where your emergency medication comes in. So we have two types of emergency medication, and this is a hormone that tells the liver to squeeze out that stored sugar. So one of the newer products is called Baqsimi. Baqsimi is a powder, and it's introduced nasally so that they can, you don't have to deal with needles drawing up. That was the old method, and yay, I am so glad we don't have to do that anymore. So Baqsimi comes in a box, and you can get the single pack or you can get the double pack. And it's a standard dose of 3 milligrams. And it's a little cartridge that looks like this. So the cartridge has a little lid that you take off. This one's got the red tape on it because it's telling you that it hasn't been used. So you can take off the red tape. You can open up the canister. You get the little, it just pops off. Oh, wrong side. And you take it, and so see, you have the nasal tip right there, and then you have a thumb button right here. So you're going to take your fingers, put it on either side of the top, and then you're going to insert it. There are gloves included, either most of the time they're rubber banded to the outside. You always want to put your gloves on first, and then it goes up the student's nose, and then you push this button until it clicks. If I pushed it right now, there'd be a shower of powder. So we're not going to do that. So this is available to increase their blood sugar. So it will work within seconds. It should start working as soon as it comes in contact with the mucous membranes in their nose.
Welcome. Today we're going to show you how to use Baqsimi. Show your family members, friends, and people you work with where you keep this device and explain when and how to use it. It is important they know how to use Baqsimi before you need it. Keep Baqsimi in the shrink wrap tube until ready to use. Remove the shrink wrap by pulling on the red stripe. Open the lid and remove the device from the tube. Caution: do not press the plunger before insertion into the nose. Otherwise, the single dose in the device will be lost. Hold the device between fingers and thumb. Do not press plunger or test device. Insert the tip gently in the nostril until the fingers touch the outside of the nose. Push the plunger all the way in with your thumb. The dose is complete when the green line on the plunger no longer shows. Remove the tip from nose and throw away the used device and tube. If the person with low blood sugar is unconscious, turn the person to their side. Call for medical help right away. Encourage the person with low blood sugar to eat or drink a high-sugar snack like regular soda or fruit juice as soon as they can safely swallow.
The other method is called Gvoke, and it's similar to an EpiPen, where it's an auto injector, and we have pictures that are at the end of this training.
Glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Please see important safety information at the end of this video and full prescribing information at www.gvokeglucagon.com.
This is Gvoke HypoPen for severe low blood sugar. It's a good idea for you and the people in your life to know how to use it before you need it. Pull the red cap off. Push the yellow end on bare skin for 5 seconds. The window will turn red to let you know when you're done.
Indication: Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Important safety information.
So the hypoglycemia fact sheet, now it goes into the hyperglycemia fact sheet. So the hyperglycemia fact sheet also talks to you about when their blood sugar is high. And so it talks about reasons why. So, I mean, high blood sugar is a cardinal sign of diabetes right then and there. So it needs attention. It's not an emergency like a low blood sugar, but it is very important to correct it. So normal variations of how food is digested. Not all carbs are created equally. So when you have especially like whole wheat grains and things like that, those carbs can stay in the blood, take a long time to be metabolized, and take a long time for the insulin to work on bringing that blood sugar back down. It seems that the simpler the sugar is, the quicker up and the quicker down you'll see. So cereal will shoot their blood sugar up, but then you have a big drop, not too many hours later. So normal variation during growth periods. So when they're going through a growth spurt, they often can use up that sugar faster. And so the same amount of insulin that seemed to do a good job before might cause them to crash or their blood sugar to drop suddenly. Also, normal variation when a female is on her period. Not enough insulin is given. So if you don't calculate the carbs correctly, you can have that blood sugar stay out of normal range. Using expired insulin, we're not doing that in the school system. Eating too much food. So sometimes they might see that extra. They said, I'm only going to drink half of my chocolate milk because they want to stay in normal range. Then you're going to see a little bit of a spike. The stress of being sick. So that can raise the blood sugar. And then stress in general and taking certain medications. Their blood sugar level is very important to take into consideration when you're doing testing. So consulting with the nurse to see if there are accommodations or restrictions for students for testing for certain activities at school. It goes on and talks about diabetic ketoacidosis, and that is a serious side effect of having long-term high blood sugar. And it talks, and so then we also would check the ketones and monitor them. So in your handout also you would have a log. It shows you what we use in the school system to document their blood sugar and how much insulin they're getting, and then what how they're feeling, how much food they're eating. So we have to document every time they have a treatment. And so the treatment would be to, there's the log sheet. It'll come up on your screen. There it is. So you're going to see the date, the time, the blood glucose result, and then you're going to see the treatment. So there's low blood sugar, hypoglycemia treatment. And so when their blood sugar is low, you're going to need to treat them with carbohydrates. That's how you're going to bring it back up. So it would be a juice, a milk, even like a granola bar, depending on how low it is and how fast it's coming down. With the Dexcom, you can look at that blood sugar and you can follow it and see how fast it's coming down. If it's coming down very fast, you're going to need to want to use a carbohydrate source. Now we're going to cover the diabetes management log. This log is what we document the treatments at school. And this doesn't always have to be when insulin is given. It can be when we give carbohydrates to correct a low blood sugar, which we call a boost, or it could be when we give extra insulin to correct a high blood sugar apart from ingesting carbs. And that is called correction. So if you look on the diabetes management log, you have the identifying information at the top. So student name, we put their parents' phone number on there so it's handy, and then also school and grade. You've got the date, the time, the blood glucose result. So if they have a CGM, then they can look and see what the blood glucose is. Otherwise, some students do have to do finger sticks. Most of our students do have a device though that checks their blood sugar. Next box is hypoglycemia, so treatment. So if their blood sugar is low, then they need to have a carbohydrate to increase it or boost. If the blood sugar is coming down really fast, you're going to need the fastest acting carbohydrate. So that would be a juice. After that, you have ketone results. So if their blood sugar is 300 and above, then we're going to check their ketones. And that's with a urine test and the strips, like I showed earlier. Hyperglycemia treatment. If they have so say they come to lunch and they have a 350 blood sugar. So we need to check their ketones. We need to look on their doctor's orders, because the orders will tell us if their blood sugar is in this range, they need this extra insulin in addition to the insulin for their carbohydrates. So we add that insulin plus the insulin according to their doctor's orders. So like I said, if it's 10 units, it might be, 1 unit for 10 grams or 1 unit for 15 grams, just depending on what their metabolism is and their insulin requirements. And then you'll put the carbohydrate, then we put the carbohydrate intake. So what are they eating? If it's a hamburger, usually you count the 2 buns, and that's 15 and 15, that's 30 grams of carbs. And so then we look at the scale, we calculate that, we put the total insulin dose. Are they feeling okay? Do they have a stomach ache? Do they have a headache? Whatever is going on with them, and then our initials. So I invite teachers to come and look at the log if they're wondering. So say that you're the teacher that's right after lunch and you want to know, does the student have difficulties with high blood sugars a lot? Because that will affect how they feel and their performance in school. Or do they have difficulties with low blood sugars a lot? Come and take a look at the log or ask the nurse. At the site, she will be able to tell you what's going on with that student and what their trends are. The next page is the algorithm. And so the algorithm is, it gives you, it's the treatment standard. And so the left column is for below 70. So it says give a fast-acting sugar and then observe for 10 to 15 minutes, and then you're going to recheck them. So they have to be in normal range before they go back to class. So sometimes your student could be out of class for a little while because we wait 10 to 15 minutes. Now with the CGMs, we do have the advantage of watching that sugar increase and go back up into normal range. And as soon as it's up in normal range, we can send the student back to class. Before CGMs, we had to wait that full 15, recheck their finger stick, and then go from there. Fast-acting carb doses, then we would call the parent and let them know, and keep trying to get their blood sugar up. So if the student becomes unconscious, has a seizure, that's when you would go for the Baqsimi or the Gvoke that we talked about. So these are for emergency situations only. If you know that their blood sugar is low, it's best to treat it immediately, give them a fast-acting carb so that it will go up. 70 to 300 is the middle column. That's considered normal for a diabetic. So they just follow their orders, and they can resume their school activities if they're 70 to 300. The far right section that says above, that would be 300. If the student feels okay, you're going to check their ketones. You're going to give them that extra insulin dose called the correction. They can go ahead and eat. We don't withhold food from them. And that's all diabetic students. Diabetic type 2 diabetic students are encouraged to watch their high concentrated sweet intake, and then also to make sure that they have that exercise component to help them control their blood sugar. With type 1s, if they're above 300, then we will follow this protocol, and we would make sure that they have increased water intake. And then also they might be getting an extra insulin dose. It just depends on what their doctor's orders are and what their, we also consult with the parent, because the parents go through very intense training. They go to their appointments every 3 months. They get additional training. They're monitored by a dietitian, a social worker, their diabetes practitioners. And so they go through a lot. If they're not feeling okay and their ketones show moderate or large, then that's when we go into the sick day protocol. And we, of course, encourage water intake and then possibly an extra insulin dose. And then just depending on how they do, what the parent says, and what their orders are. So we have to consult all of those factors. The next page is teacher actions for the teacher. So you see the student every day, all the time in your class. So you are the eyes and ears to watch that student every day. So your job is to receive your diabetes training, know what's important regarding signs and symptoms of highs and lows, and then know what the nurse, when it's important to send the student to the nurse. So participate in 504 meetings, IEP meetings, and know what the care plan is for the student. Work with the school health team to implement the written care plans. So you can give your input as far as how the student is in your class and behaviors that you observe. Recognize that a change in the student's behavior could be a symptom of something very important, like a blood glucose change, and that they would need immediate attention. So, and then if they're not feeling good, you want to always send them with a buddy to the office. If they're really not feeling good, make sure you call the nurse and send campus security. The nurse can also come with campus security to bring the student back to the office. Provide a supportive environment. So you want to provide dignity, you want to provide confidentiality, but you also want to ensure that they're getting their education just like everybody else. So be supportive to help them manage their diabetes effectively and safely at school, and to participate as much as possible. Encourage them to drink their water and monitoring their glucose. Provide classroom accommodations as directed, and provide instruction. So diabetic students have free access to water and free access to bathroom. That should never be withheld from a diabetic student, whether they're type 1 or type 2. Provide classroom accommodations according to their plans. Provide instruction to the student in the absence of, when they're absent from school due to diabetes care. And it could be just because they had too many highs during the night or the day before, or too many lows, and they just don't feel good. And it also could be because they went for the follow-up appointment with their diabetes clinic. Provide information for sub-teachers. This is very important. Have a sub-folder. Make sure that you have instructions in there. You can use this handout to let the sub know that you have a student with diabetes in your classroom. Notify parents and the school nurse in advance if there's going to be a change in schedule. So that's field trips, 2 weeks advance notice, please. Also class parties, give us a few days notice so that we can calculate in class parties. With the pump, it's pretty easy to give them that a little extra insulin dose, say an hour and a half, 2 hours out from lunch, and they can get their insulin dose to cover a cookie or some, pretzels or whatever you're having for or pizza. That's a common one. And special events other than those. communicate with the school nurse and parents regarding concerns for the student, and treat them as other students except for their medical needs. Encourage them to participate fully in activities and events. That includes sports. We do a lot of training for coaches so that students can participate in sports, and respect the student's confidentiality and right to privacy. The next page is teacher rights and responsibility in caring for students with diabetes. And so this page it's written like a contract, but we don't necessarily have you sign it. It just gives you a framework of things that are responsibilities in watching over a student that has diabetes. So making sure that the student comes to the health office when they need to be seen. So generally they take insulin before they eat. And it could be a brunch, could be a breakfast, a brunch, a lunch, or snack in the afternoon if they're in the after-school program. The student is able to check their blood sugar in the classroom. The CGMs make this very easy. Also, the student needs to receive insulin every time they eat. And the student should report to the health office for that insulin administration. And then it also talks about what plan that the student is on, and you will be notified of that. And then be prepared to recognize signs and symptoms. That's why why you're going through this training. Also to recognize a change in the student's behavior, which could be indicative of a change in their blood sugar. Provide and encourage access to water and bathroom. Remember, those are free privileges of a diabetic student. And then notify the nurse if there's something out of the ordinary. Notify the parent or guardian ahead for any change in schedule. Call the school nurse for any questions, and include this information in your subfolder. The next page is 10 things school staff should know about type 1 diabetes. There's a lot of myths out there, and unfortunately we've had staff that has approached diabetic students and said, are you supposed to eat that muffin? Why are you going to eat that cupcake? Are you supposed to have that cookie? I don't think you're supposed to have cookies. That's not your job to challenge what they're to eat and not eat. If you can ask them, does the nurse know that and giving you insulin for what you're eating? You don't have to identify what the specific food is. Just ask them if the nurse knows that they're eating that and they got their insulin. Number 1, children will not outgrow type 1 diabetes. No, it's a diagnosis for life. And so being supportive and helping the student to be involved in all the activities that they are able to be involved in, and to have as normal a school experience as possible. Insulin is not a cure. No, it's a treatment. Number 2, it takes a lot of work to manage diabetes. Yes. And it can be daunting for someone who's a diabetic or the parent of a diabetic. Technology is helpful, but it doesn't work on its own. So yes, technology is very helpful. It gives us lots of information without the finger sticks, but they do have to make sure that they order their sensors. They have to make sure that they get them in the mail. They have to make sure there's extra maintenance involved. Blood sugar levels can change quickly. Yes, they can change very quickly, and a student can go from stable to unstable fast. Low blood sugar needs immediate attention. Yes, we covered that. And high blood sugar needs extra trips to the bathroom. Most likely, kids with diabetes can still eat sweets. There we go. It's number 8. And number 9, even students who are independent may need help managing diabetes. That's why we have knowledgeable nurses at every site, and then district nurses to also do trainings and assist with diabetic care. Kids with diabetes want to be like everyone else. Yes, that statement is huge. So put on your empathetic, compassionate heart, and help them to do the best that they can, considering their diagnosis. The next page is about the Baqsimi. It covers it in picture form. I showed you the actual medication and the administration, but this goes over how to administer it. It tells you step by step. The next page is on the Gvoke, and the Gvoke is the auto injector. Baqsimi, it's like Baqsimi, it's still glucagon, which is the same hormone that tells the liver to squeeze out some extra stored sugar and bring their blood sugar up. But it's an auto pen. It's given in the arm, different than the EpiPen, because the EpiPen needs to be given in the thigh. There's a push button in order to give it. And so it's not as big a needle, as long a needle, and it's not, and you generally don't give it through clothes. Look over this handout, and if you have any questions, a district nurse would be able to answer questions for you, or the LVN at your site. Thank you, and this concludes this training.